Psychologists have Reddit. What's one thing a patient has told you that caught you off guard, or vice versa? Patient's perspective? My therapist once abruptly ended our session after telling me I needed to go to the ER. I had been in a car accident the day before and had an undiagnosed concussion that was pretty bad. I was so out of it I didn't even realize I was out of it. He later told me I was talking about inappropriate topics. I was so embarrassed I didn't ask what I specifically talked about. I didn't want to know at that point, and wasn't making much sense. I'm just glad he recognized I was off that day and helped me get to the hospital. Man, concussions are hell. I've had a few. I've got one sister-in-law who hasn't spoken to me since I was chatting with her via Skype chat while recouping in the hospital. I don't even remember what the frick I said. How have you had multiple concussions? Are you just really unlucky? I've had similar, where I was so panicked that I was gonna kill myself, and had been for a few weeks, that my therapist just recognized I was deteriorating and walked with me to the nearby hospital. My GP got me help when I was in a very bad place. I went in for a skin issue, but after a few minutes she stopped me and asked what I was so upset about. I told her I wasn't upset, I just needed some skin cream, because the OTC stuff wasn't cutting it, and she just shook her head and told me that my eyes said I was in panic mode and that I needed help. She then held me while I had a breakdown over some bad news about my child and got me an appointment at the mental health clinic. When I was in first or second grade, the school counselor fell asleep when I was describing a bullying situation that I was in. I was so young that I didn't know how to respond, so I just sat there in his office until he woke up. That's freaking horrible. Did you ever say anything? Mine recommended homeopathic remedies for treatments and was a freaking light nutcase. She was chill though we played Jenga. Still dislike her a lot though cause she made fun of my spelling while I was there to talk about being bullied, so I quickly learned to just not do it. Was talking to my school counselor about some mental health issues and told him that I like playing card games to take my mind off of it. The man literally opens his cabinet and pulls out a briefcase full of Yu-Gi-Oh cards. I'm a massive nerd, and says so. Wanna play? Don't get me wrong, but this guy had a lumberjack beard, was fit and looked more like an athlete than a counselor, so I was shocked. Got over my problems and played every Wednesday against him. You activated his trap. I paid and sat through an entire session of therapy during which my therapist ranted as to how great of a career he could have had as a stand-up comedian and how much he regrets his current profession. I kinda agreed with him near the end. Except, it wasn't funny. Well, that's kind of funny. It looks like the biggest joke wasn't the ones he said, but the one he lived. Did you at least laugh? I had a therapist tell me when I was a teenager that she didn't know what else to do to help me, because it seemed like I already understood everything pretty well. This was after my overbearing and crazy helicopter mom dragged me in for being depressed. Then she switched to therapying my mom, and my mom quickly was in tears, because she has the emotional strength of a child and wanted it to be about me when it was actually all about her. I knew exactly why I was depressed. I was stuck by myself in the middle of nowhere with her crazy ass. No personal space, no ability to get away, not being able to say no, her getting jealous of my friends when I spent time with them. It would make anyone depressed. She didn't even let me sit with the therapist by myself. My mom did this and would change my doctors, because they wouldn't tell her what we talked about in sessions. Then she found one who put me on all sorts of meds for depression, anxiety, and sleep. She's as completely dependent and has turned into an ever bigger mess. Mom took me to therapy for being ADD, defiant. I got put on meds, told me for years I was the problem. I quit therapy, worked out my problems on my own. Found a file later in my house, records from my old therapist. He recommended that my mom should actually go on meds and stop drinking. First time I saw a counselor, he was looking over my paperwork and said he could tell from my handwriting that I was good in bed. I kid you not. I was so caught off guard, all I could say was, I think I am. So young and not assertive at all. Found out he got in trouble for an inappropriate relationship with a client. But it really screwed me up for a bit, him saying that, because I have problems setting boundaries with men. That counselor is a predator. He took advantage of being in a position of power over a vulnerable person. I hope you've found ways to build healthy boundaries. Told mine I had seen him grabbing a drink at the same place I used to go get drunk before Ovid. He stared at me like I had discovered something NASA was hitting. We had a laugh and he confessed it. Context: I had huge drinking problems and he told me he didn't like to drink at all. That's actually pretty funny. It is. After that, things got way easier for me, and he inspired me to become a shrink myself after this crazy times. And at the rehab I went to, I had an absolutely amazing therapist. Dude had been through trauma as a kid and was married, religious, with kids when he realized he was gay. He and wife divorced amicably. Point being, he had been through a lot of life. He had an amazing therapist who really helped him come to terms with a few things. He decided he would become a therapist himself. 10 years later, to the day, he graduated as a licensed therapist. He really made an impact on me. He practiced as a doctor and just had a lovely understanding of people and the world. My favorite thing he used to say went along the lines of people make the best decisions they can, at the time, with the knowledge they have. Reminds me that all my frick-ups and mistakes don't have to be constant sources of shame. He did it, you can too. I did most of my training in a pediatric hospital. One of my patients, young adult, with relapsing leukemia cancer since young childhood, wanted to go to an outdoor festival with their significant other. The oncologists were adamant that due to the patient's low white blood count and current course of treatment, they shouldn't let them go. Basically, if that person caught an infection, it would kill them. The patient was pissed, understandably so, and said something like, "I've had this disease since I was a child. I know I'm going to die soon. I'm going to the concert whether you like it or not, and if I die, then at least I'll do it on my own terms." It's always quite moving when a young person expresses their own mortality and confronts it head-on. I had such admiration for that person, and they are right. Why suffer just to live longer? The patient could wear a mask and be very careful, but should still have fun and live. My therapist and I would end every appointment with a discussion of the latest Game of Thrones while it was airing. A great way to end things. Even the itty end of the show got plenty of light-hearted ribbing. It was great BC, it wasn't too personal, and after talking about ex-abuse for an hour I could leave without being such a sad sack. Dude, that's awesome. I want your therapist, even though I don't need one. She's legit a really cool lady and helped me a lot. Plus she had a dog and he was awesome, past tense only, because I also now don't need regular therapy. That's awesome for you. Looks up therapists who watch got with their patients. Sounds like a nice little palate cleanser. I was in my second ever session, which coincidentally was right after my aunt's funeral. I was talking about some stuff that had happened with my sister, who I had already said was probably my biggest issue, and he asked, "Why is this person in your life? Why do you want to continue a relationship that hurts you so much? Do you actually want this relationship?" I was floored. It had never occurred to me that my sister didn't get a place in my life by default, because family. I can't tell you how much this improved my life. Left both my mother and her reincarnate, my sister, behind years ago. Can't express how much better my life is without them in it. Rotten is rotten. It had never occurred to me that my sister didn't get a place in my life by default, because family. I wish more people understood this. There was a particular person in my wife's family. Her sister always calls crying, because this person upset her. My wife is always in a bad mood because of this person. I told her she can just cut them out, but she doesn't want to, because it will affect her relationship with the not itty people. But I'm like, you don't need anyone itty, and you don't need people that would pick itty over you. I'm a clinical psychologist working on the back end of my postdoc. I work predominantly with acute adolescent presentations such as chronic self-injury or sexual trauma. I'm so used to the young people I help hating themselves. It hurts a lot inside, but I firmly believe in catharsis through positive regard and validation. So as we do our therapy, I often sprinkle in comments here and there about some of the things about them that I admire, respect, or appreciate. Things like their perseverance, their kindness, or their passion for an interest of theirs. I'm always so caught off guard when they agree with me or say something nice about themselves that it's really the only time I find myself slightly tearful in session. I'm always so damn proud of them, and it hurts to hear the depths of their self-hatred. Those little moments of growth make me feel like it's the first warm day after winter. As a child sexual trauma victim, who's been through a good deal of therapy during my teens, I'd like to offer a little insight. From my perspective, I'll probably make a general statement or two. Just know I'm speaking from experience, and it's probably a slip-up. After all that I went through, the self-hatred, guilt, all the miserable feelings were there. The normal stuff. The odd thing was, I knew and acknowledged I was a good person. I knew I was smart. I was a solid test taker. I had a lot going for me. I was strong and perseverant. I knew all these and nobody had to tell me. It was nice being told it, but I knew. I think, and I could be wrong, but I think that as victims we are often aware of what we have that's good. It's the fact that trauma is such a primal, sensation, or condition, or whatever word I'm missing here. I can acknowledge all I want that I'm a good person trying to do my best, but even after all the therapy I went through, I still can't help feeling guilty and miserable at times. I can't generalize and say I know every trauma victim, or even very many, but I feel like this is common. Your brain knows you're a good person, but somehow it can't accept it. It sounds so contradictory, but it's the best way I can describe it. Telling those kids and getting them to admit that they're okay is a huge first step, because it never really stops. You just drown the self-hatred with self-love. You tell yourself, sometimes forcefully, that you're a good person and that you deserve good things, or that life's worth living. I think that's the biggest thing though. It's teaching kids like me to love what they already know about themselves. Not to replace the hatred, but in spite of that. I know this is long and very much anecdotal, but it's something I seem to see in the handful of other trauma victims I have met. Although I'm not the most perceptive person nor am I a therapist. Maybe I'm wrong, but if this could help even one person, or many, I figured it is worth sharing. This so much. I know I am a good person. I know I am smart and funny and talented and charming, but I also hate myself for not saying no or stop, for just laying there and taking it. I was 10 and it only happened once, but I was forced to live with that person and forced to not tell anyone, because it would destroy so much more lives than mine. I am 28 and never had a boyfriend. Generally do not like being touched in any way and have one maybe two friends. I am a good person, I know, but sometimes I wish I was an emotionally healthy person. Just thinking about you giving unsolicited, thoughtful comments made me smile. Keep up the work, my man. You're changing worlds. This is a really nice response in a mostly negative thread.